In this lecture, I will discuss the mandible anterolateral superior view. This is the anterolateral and we view from the superior. This is the playlist of Nutter's anatomy flashcards. In this lecture, I will discuss the 8 labels, their detail and clinical point of view. Very important lecture. First label, you can see this is the condylar process, and this is the condylar process of head and neck portion. Second, we have coronoid process. First is the condylar, it has condyle, you can see, and second is the coronoid process. The third label, you can see, this is the submandibular fossa. This is the submandibular fossa. And the fourth, it represent a line. The line is passing through this is the mallohyoid line. The fifth, you can see here, is the foramen opening. This is the mental foramen, and from the foramen the vessels, nerves pass and supply the bones. Sixth, you can see, is the prominent area. This is the mental protuberance. Seventh, we can see, is the body of the mandible. And eighth is the ramus. First we have a condylar process, second coronoid process, third is the submandibular fossa, fourth one is the mallohyoid line, fifth is the mental foramen, sixth is the mental protuberance, mental foramen, mental protuberance, seventh is the body, and eighth is the ramus. Now we will discuss the details of it. Mandible or lower jaw, mandible also called lower jaw, contain the mandibular teeth and mandibular foramen. The inferior alveolar neurovascular bundles pass through the, as I told you, foramen. From the foramen neurovascular bundles pass and it innervates, it supplies the mandibular teeth, and it innervates the mandibular teeth and supply with blood. The nerves ends as a cutaneous branch. Cutaneous means it supply the skin that exit the mental foramen. Also, which nerve supplies? Mental nerve. The condylar process. First label, condylar process of the mandibular articulates. Condyles articulates, usually mostly articulates. Condyles always articulates with the condylar process of the mandible. Articulates means form joint with the temporal bone, forming the temporomandibular joint, TMJ. TMJ. Because of the vulnerable location, mandible is the second most commonly fractured facial bone. This is important for MCQ's point of view. And nasal bone is the first. This is also important. Nasal bone first, and second is the mandible. The most common site of fracture are the cuspid area and the third molar area. These are also very important for most commonly site of fracture. Cuspid, canine tooth, and the third molar area. Now we have clinical. In the clinical point of view, you can see here fracture of the mandible are fairly common. It's second most, and first is the nasal bone. The mandible is the U shape. You can see mandible is the U shaped, renders it liable to multiple fracture. Okay, it can high risk of multiple fracture which occur in over 50% of cases. The most common site of fracture are the cuspid, canine area, and the area just anterior to the third molar or wisdom tooth. Here we discuss when any kind of fracture, any bone break, blood oozing from the mandible and collect in the loose tissues of the floor of the mouth. Blood oozing and collect, because the when blood is leakage from any area, it after some time form a clot above the mallohyoid muscle. In this lecture, I will discuss the anterolateral superior view of a bone mandible. It is the second most common fracture bone. First is the nasal, and also common sites of fracture are cusp, canine tooth, and the third molar area. I discuss all the labels, very easy labels, you can remember this, and also I'll discuss the clinical point of view of mandible. I definitely sure that you like this video, very important for all medical students. Thank you.